Hi everyone, this is Elizabeth Thomas. Today I'm going to talk to you briefly about my genetic disorder that I looked at this course, Tyrosinemia Type 1. There are 3 types of this disorder. However, I'm only going to cover Type 1, which is the most severe form. So let's jump in. What is tyrosinemia type 1? It's characterized as an amino acid disorder where in the body has a reduced capability to metabolize tyrosine, which is found in most food sources. The enzyme fumarate acetoacetate hydrolase, FAH, is responsible for metabolizing tyrosine. When the enzyme is not present, there can be a buildup of toxins in the liver, which is the primary site of tyrosine metabolism. So very important that we have this enzyme. Tyrosinemia type 1 is also known as Fah deficiency. It's a very appropriate name. The lack of FAH results in the accumulation of the byproducts fumarate acetoacetate and mallyl acetoacetate that are going to go ahead and cause hepatorenal damage. So our liver and kidneys actually sustain a bit of damage here, and that's the primary concern for these patients. Signs and symptoms are going to include acute and chronic symptoms. Acute are going to be present at birth or shortly after in the first few months of life. Listed here, poor weight gain, enlarged liver and spleen, distended abdomen, swollen legs, jaundice, possible liver failure. So those are not good for the young patients. Chronic form is less severe. However, the onset is gradual, but is still pretty severe. Symptoms here include poor weight gain, cirrhosis of the liver, vomiting, diarrhea, and ascites, which is a fluid accumulation in the abdomen. So these are not very good things for a patient to experience, and it's quite a painful disorder to be going through, as especially an infant. So what actually is happening in the body? The function of our normal non-mutated FAH gene is to provide the instructions for making the enzyme FAH to break down that tyrosine amino acid. Normally, the enzyme is quite abundant in the liver, kidneys, and other tissues. When we don't have it, specifically, FAH is going to convert a tyrosine byproduct called fumarate acetoacetate, which I mentioned earlier, into smaller molecules. And those smaller molecules will be excreted by the kidneys or used to produce energy in the Krebs cycle, or used to make other substances in the body. So it's very important that this tyrosine gets broken down and is used appropriately. So the responsible gene is actually called fumarate acetoacetate hydrolase gene. It is located on chromosome number 15. An individual will inherit this as an autosomal recessive disorder. The defective gene must be present in both parents for the child to inherit the disease. So if we look at a Punnett square as an unaffected allele as being capital A and an affected allele as being a little a, when we put two individuals together, if we get the double little a, those are going to be our affected individuals, and the others will either be unaffected or carriers. So let's look at a family tree here. We have 4 generations, and you can see the pink dots are going to be characterized as our individuals who are carriers of the gene. So they will have at least one of the affected alleles as the little a, and the individuals who are listed here as the red marks are going to be affected with the tyrosinemia disease. So you can see that these individuals must have had at least must have had parents that both had at least one of the defective alleles. So you can see our little a's, unfortunately, are going to be our phenotypically expressed tyrosinemia patients. So how do we test for the disorder? There are many genetic screening tests available, but most newborns in the United States are going to be tested for the disorder shortly after birth with a simple blood sample taken from their heel. If we're looking to see how much these cost, depending on what state you live in, they can range anywhere from $15 to $60, so it's pretty cost effective for most parents to go ahead and screen for this disorder. So when we do, company, Centogene, the rare disease company, offers a full catalog of testing, not just for tyrosinemia, for many other disorders as well. So check them out. They have a vast array of collection of tests. Right now, there are currently 122 options for testing for this particular disorder. They include both biochemical and molecular genetic testing. So you have lots of options here. Lots of different samples are appropriate: blood, saliva, many different options. So there's no reason that an individual shouldn't be tested. So when are we going to test for this disorder? Since the disorder can affect the individual as early as infancy, confirmation testing should be performed on all those suspected individuals once that screening comes back from the newborns as soon as possible, because we want to get these patients into treatment. So early detection is extremely important to ensure that the patient isn't left undiagnosed or untreated. It's very important that we get on top of it early. Without medical intervention, hepatorenal failure is the concern here. And unfortunately, some of these patients could actually die from this disorder. So when we do find an individual that has this disorder, what do we do? What's our treatment plan and options? So up until recently, and I'm meaning in the last few years here, liver transplant was the only option. It's pretty invasive, especially for infants, until doctors had until we had invented a medication for the disorder. So right now, success has been happening with a particular drug called niacinamide. It's a drug of choice for these patients with tyrosinemia type 1. In addition to the restrictive diet that reduces the amount of tyrosine and phenylalanine, those two amino acids, if we can get those out of the diet in large amounts, that really helps these individuals too. But it's very important that we get these individuals treated and screened as soon as possible. So I hope, here's my references. I hope my little talk here gave you a little something to think about. I had fun exploring this disorder, and I hope you enjoyed. Thank you.